Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation and is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. We invite you to learn more by visiting healthcareexperience.org. Hello and welcome to the first ever episode of Healthcare Experience Matters. I am your host for today's episode, Casey Callanan, and today joining me is Katie Owens. Katie is co-founder and president of the Healthcare Experience Foundation. Katie, welcome to the podcast, and I'm going to have you just kick things off for us today by please just letting us know a little bit about the mission and the vision of the Healthcare Experience Foundation.
Casey, thank you. I'm so thrilled for this to be our inaugural podcast of Healthcare Experience Matters. And Healthcare Experience Foundation, our mission is really audaciously simple. We want to create environments where every person can both deliver and receive the best healthcare experience. What we know is that comes through shaping culture and building competencies and practices that embody the environments of excellent patient experiences and excellent places to work and practice.
So tell us a little bit about you, your background, and also some of the thought leaders that make up this Healthcare Experience Foundation team.
Sure, I'd love to, Casey. I feel so fortunate throughout my 20 years working in healthcare to be raised by some of the most extraordinary leaders, and have had the opportunity to work in patient care in both children's health care and in child life therapy, and then being a part of one of the first offices of patient and family-centered care, working with leading for-profit and not-for-profit health systems, and then having spent the last 12 years of my career coaching hospitals and health systems across the country to leverage culture to create amazing outcomes. We're talking about demonstrable improvements in patient experiences of care, retaining our star employees, improving quality and safety outcomes, growing market share, improving physician engagement and loyalty. And through that work, not just in the years of coaching, but throughout my career, I've had the opportunity now to work with some extraordinary colleagues that I now get to call team members. And we have put together a coaching team at Healthcare Experience Foundation that I believe is hands down world-class. Our team is made up of leaders who have walked in your shoes. They have led organizations in roles such as CEO, Chief Nursing Officer, organizational development and learning, patient experience, patient and family-centered care, measurement and improvement. And we are so motivated and see this as a personal calling to work with our clients to really honor their championship of an excellent healthcare experience and line up the resources and the coaching and the learning environments to help our client organizations be successful.
I totally get that. Thanks for taking the time to kind of give us that background on this first ever episode. So exciting here on Healthcare Experience Matters. So tell us a little bit about the events and some of the resources and services that your team delivers to fulfill this mission.
What we've seen is that the path to success is simple, yet the work is challenging. Together, working with the hospitals and health systems that we get to call clients, we refocus on the healthcare experience. We really refocus on to create the best patient experience. How are we engaging and developing our workforce, our leaders, staff, and physicians who through their hands are going to deliver an excellent, safe patient experience? And to that end, whether it's through the exciting launch of Healthcare Experience Matters, our webinar learning events, the launch of the Healthcare Experience Academy, which we believe is a leading learning environment to focus on the skills and competencies in a video-based and e-resource type environment, to the coaching and training that we do virtually and on-site. It's focusing on the skills and the adult learning strategies to be successful driving change. And that's the incredible work that our team gets to do as our day job.
And of course, I want to ask you about this podcast, as this is the first ever episode, and we want to just introduce folks at this stage to what this is and what this will be about moving forward. So, in your words, what is the purpose of this podcast, and what can we anticipate from learning from it in the plenty of episodes that are to come?
Gosh, we want to focus on the bright spots. We want to focus on supporting the champions of healthcare experience excellence, those that are showing up every day, focusing on creating cultures, better work environments, more patient and family-centered care. We want to inspire the champions who are every day working to move healthcare forward, that are comfortable with the discomfort of change and what it means to take a next step forward and to be courageous and constantly elevating patient-centered excellence through workforce engagement. And so we want Healthcare Experience Matters to be about those doses of not just inspiration, but ideas and innovative strategies, as well as sometimes just the practical nature of innovation. One of my favorite quotes is from Theodore Roosevelt: do what you can with what you have where you are. And we hope to provide more resources to the champions of healthcare experience excellence.
What are the most pressing issues from your experience being out there with folks that are on the front lines in healthcare? What is the most pressing needs that you think you're seeing right now?
I think there's no question that 2020 has shifted our paradigms. As we have been working with hospitals and health systems over the last year and a half, we have seen the rapid acceleration of the need to focus on topics like resiliency and gratitude and communication skills, emotional intelligence, more consistent patient and family communication and teamwork. And so we hope to tackle these topics and more in how we support leaders, staff, and physicians, from things that we're seeing out in the field day to day with our coaching, and also shining a light on thought leaders in healthcare and how this is working day to day in their organizations.
Katie, do you have any recent success stories you want to share with us about some of the work you've been a part of?
Absolutely. In the more recent months, I've had the opportunity to work with a health system that's just restarted their focus on leadership development. It obviously has been paused for quite some time. This is a really high performing organization. They're 4 stars with CMS. They're probably in about the top 10% of the national database that they measure their patient experience with. And in preparing for this leadership development work, the CEO very candidly said that he wanted me to work with them on emotional intelligence and compassionate practice. And in his mind, they had gotten to where they were at by focusing on, at the time, the right things. And what the last year and a half has taught is that he really views that to differentiate themselves going into the future, it's equipping their leaders with tools to be more empathetic and compassionate and to hone their personal and social emotional intelligence. And that's a shift, Casey, that I don't think we would have acknowledged before the pandemic or any of the trials and tribulations that have been hard in 2020. It's how do we build a more team-based culture where we're sensitive to the needs of one another and skip beyond, hey, we've done our checklist. We're focusing on how we treat each other as people.
No, I really appreciate that. Thank you for sharing that one with us. I really am curious about what some of the other gaps are that you see that's out there right now, some of the learning gaps. What are some of the leadership and communication learning gaps right now? And what are you doing to kind of help fill those gaps?
Yeah, we are seeing a few things really emerge. Like I mentioned, the focus on compassion and emotional intelligence. The other thing I think we're really recognizing is that in a traditional, whether it's a medical school education, in a nursing program, in a professional school, very little time is designated in that learning environment for leadership skills, for communication savvy, for emotional intelligence, for some of the things we're talking about here today. And I think that there's an opportunity to close those gaps. At the end of the day, we know that communication is the number one cause of sentinel events, medical errors. It's also the key driver of patient experience of care and how employees and physicians evaluate their loyalty to an organization. And so doubling down on communication, as basic as that is hand washing in the clinical environment, communication is the most commonly practiced procedure across the continuum of care. And so we're really seeing an opportunity to fill some gaps. And it's been really rewarding to work with some of these early adopters coming off of the pandemic to hone these skills and practices at a deeper level.
Absolutely. And I think that might dovetail back into the whole reason behind the launch of this podcast. I know that things like gratitude, communication, emotional intelligence, there just doesn't seem to be enough time to work in these quote unquote soft skills when there's perhaps so much other things to be taught.
There is a quote by a Greek poet: "We don't rise to the level of our expectations, we fall to our level of training." I think what we've seen is that in healthcare, we have gotten really good at training for the emergencies. We practice the drills, the tasks, the incident command protocols. We focus on securing supplies, coordinating our responses with community agencies. What we've really learned is that we have not adequately prepared our workforce for the type of enduring stressor that, for instance, the COVID-19 pandemic has introduced. We may have undervalued the practices, training, and repetition that is required to handle the degree of workforce anxiety, the need for successful coping techniques, and burnout, and keep the pace of change that's necessary to innovate. As we're pivoting forward, we're really looking at techniques to seed great teams that really honor and build on each other's strengths and are not blind to vulnerabilities, but we look at vulnerabilities and challenges as learning and growth opportunities, not things that we are angry about or frustrated, but we've got to look for the learning.
Katie, tell us a little bit more about this podcast.
Of course. We want to honor the healthcare champions. We want to support listeners who are looking for new ways forward, a path to success, to overcome challenges, those that are seeking a continual focus on a legacy that leads to more personal and professional fulfillment. We want to also help relieve some of the pressures and give a safe space to refocus on purpose and joy, not only for themselves, but also for their coworkers. One of the best parts of coaching is helping others achieve a closer degree of their personal, professional visions. And we hope that in our content and in the resources that we're providing, listeners will walk away with hey, I've learned a few new things. I can apply this. I feel more refreshed and energized myself, and I can support my team better.
And Katie, before we wrap up this very first episode of Healthcare Experience Matters, is there any other final thoughts you have on the mission of this podcast?
My hope for our listeners is that you feel every time you listen to one of our podcasts that you walk away with something for your personal, your professional growth and development, that you look at our bite-sized sessions as a way to re-inspire, recommit, focus on a challenge that you might be experiencing. And our commitment is that if you have ideas for topics and issues you want us to tackle, that you reach out to us and let us know. Our first and most important mission is supporting you, the healthcare champion, in your day-to-day work. We know that the work is challenging. We know that the mission is important, and we honor your work.
Thanks again for listening to this first ever episode of Healthcare Experience Matters. To learn more about the ways the Healthcare Experience Foundation is helping organizations advance the healthcare experience, here is once again Katie Owens.
We are the patients and the caregivers. At various times in our lives, we are either caring for or being cared for. This is the nature of the human experience.
People don't remember what you say. They don't remember what you do, but they do remember how you make them feel. One of the biggest hurdles in healthcare today is not what we do, but how we do it, and a deep conviction for why we do it.
Healthcare experiences are never a single encounter. They're made up of millions of small interactions.
Every single moment of care gives us an opportunity to build trust, confidence, and resilience.
Our vision is audaciously simple, shaping cultures so that every person can receive and deliver the best healthcare. There are over 1.2 billion healthcare visits in the United States, supported by a healthcare workforce of over 12 million employees. That equates to approximately 4 patient visits for each of us. Every physician, nurse, administrator, loved one, and patient matters. The Healthcare Experience Foundation brings together patients, caregivers, and communities to share information that will inspire new and better action.
We believe in elevating leading practices, honoring the great that is happening every day, despite the increasing pace of change and distraction.
We're here to provide ideas, research, tools, and inspiration. Every organization wants to improve, to do better, to achieve greater experiences. Sometimes the struggle is with the how. We are making resources and content available to anyone, anywhere, anytime.
We humbly ask you to join this movement and to allow us to be part of your journey as you constantly aspire to improve care and create better environments for all who work and receive that care.
We want to have a dialogue,
build on our collective wisdom, and celebrate successes.
Stay connected as we put thought leadership, transformative care, and brilliance on a pedestal
to support, energize, and re-inspire
those who are everyday advocates for healthcare delivery excellence.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation. To learn more, please visit healthcareexperience.org. That's healthcareexperience.org.